Hello everyone, welcome. Today's topic is smear interpretation. Peripheral blood smear is a laboratory test that involves the cytologic analysis of peripheral blood cells. In this topic, we will learn introduction of the smear, thick smear interpretation, thin smear interpretation, and summary. Introduction. Blood taken by finger prick or the venous aspiration is smeared on a slide and stained accordingly. The microscopy requires a skilled systematic approach which we are learning today in this topic. Peripheral blood smear is a very valuable tool for pathologist and the clinician. Quick assessment of the smear can be completed within 3 minutes, but an abnormal smear would require longer time. We can estimate WBC count, platelet count manually by using certain formulas. Morphology of WBC, RBC, platelet are very well seen on the stained peripheral smear and always correlate with the patient's history, CBC finding and other relevant test results while interpreting the peripheral smear. Thick smear. Thick smear are made of thick layer of dehemoglobinized RBC. Hemoparasites are more concentrated in this smear as compared to thin smear, mainly used for the parasitic detection. It is a gold standard for the malarial parasitic detection. It is also used for the diagnosis of disseminated histoplasmosis and other hemoparasite detection. I have already covered the smear preparation and malarial parasite detection and identification in the separate video. Link is in the description below. Feel free to check out those information. Thin smear. Gross examination means looking at the stain slide gives a lot of information. As you can see in this picture, first slide is a dark stain with a lot of hemoglobin content, may suggest polycythemia. The second slide is a normal peripheral blood smear. Third slide is looking paler than the second slide. It is due to anemic blood or the improper staining or understaining of the smear. Fourth slide is looking dark bluish in color, which this color is due to the paraproteinemia like gammopathies. Example is multiple myeloma. Let's learn how to systematically review the smear under the microscope. First, adjust a 4x lens for the review. This is the scanner view of the slide. You can observe the overall quality of the smear like evenly spreaded smear or irregular smear or any other artifact on the smear are present or smear staining quality is good or not. Important parasite that you can identify in this view is microfilaria. They are usually seen at the tail region of the smear but may be seen in the other areas as well. You can easily pick up the microfilaria on the 4x view. They are looking like a long stain thread with the multiple stained nuclei in the body of the parasite. Now change the lens to 10x, also known as a low power view. In this view, you can identify platelet aggregates or the clumps or the clot or the fibrin threads on the tail and pre-tail regions. One can observe the WBC distribution in the smear. They are well dispersed or the clumped together at the one place. You can identify megakaryocyte as well. On this view, megakaryocyte is usually not seen in the peripheral smear, but due to stress or other condition, you can identify it on the smear. Now change the lens to 40x, also known as a high power view. You have to choose the pre-tail area where RBCs are slightly overlapped on one another. You can manually count WBC count and compare it with the automated cell counters count. Observe the 10 high power field, count total WBC in these 10 fields and divide it by 10 and multiply it with 2000. This gives the approximate WBC count per microliter of peripheral blood. You can perform WBC differential count on this view. You can observe RBC morphology like cystocyte, sickle cells, target cells, teardrop cells, stomatocyte, ovalocyte, microcyte, macrocyte, etc. Any other large and abnormal cells and parasite can be identified on this view. For detailing of RBC morphology and platelet count, you can now change the lens to 100x, which is also called the oil immersion lens. You have to put immersion oil on the smear before switching to 100x. In this view, you can clearly see the RBC morphology like RBC inclusion, parasite like malaria, WBC morphology like Dole bodies, hypogranular or agranular neutrophils, platelet morphology and count. Observe the 10 oil immersion field to count platelet, then divide it with 10 and multiply it with 15,000. This will give approximate platelet count per microliter of peripheral blood. You can also identify small platelet aggregates on this view. RBC morphology and various RBC's abnormality, WBC morphology in normal peripheral smear, and leukocytosis interpretation. All these topics are already covered under the separate videos. You can check out those, and the links are in the description below. These are the references for this video. Hope you have gained some knowledge about systematic interpretation of the smear. Thank you.